We'll do some introductions and then we'll talk a bit about what we're going to cover this evening. So first of all, I'm Dr. Zoe McGovern. I'm clinical psychologist and clinical director at the Autism and ADHD Assessment Hub. And I'm joined by Jess tonight.
Yeah, I'm Dr. Jessica Donohoe, the other clinical director at the Hub and also a clinical psychologist. So welcome, everyone.
Jess isn't very well this evening, so we've got to be kind to her. She'll let me know if she's flagging and I need to step in. And we've also got Anna from Autism and ADHD Assessment Hub as well, who's supporting us with the presentation, and she will take any questions that might come up in the chat as well as we go along, because hopefully we'll have some time for questions at the end when you've had a chance to process and think about the things we've discussed this evening. The session is being recorded, and that is purely for the purposes of sending out the session to people who've not been able to join us this evening. So I would just ask you to bear that in mind in terms of like raising any questions. Please don't mention actual individuals or yourselves, or keep everything anonymous for that purpose. And bear in mind, this isn't a confidential space. Okay, so this evening we're talking about low demand communication, and in a nutshell, what we're hoping to think about is helping your autistic child to feel safe by reducing pressure and supporting autonomy. We'll have the next slide, Anna, if you don't mind. Thank you. So I always say this at the beginning of our sessions, that it is for information and awareness only. This isn't about thinking about diagnosis, and it doesn't replace any professional advice. So if you've got particular concerns about autism or ADHD, specific things that you would like to address, please speak to a qualified clinician. That can be one of us by reaching out after the session and doing that via email or phone call privately. Or the next slide, Anna. Thank you. Okay, so thinking about the session objectives and being really clear about what we're hoping to cover today, we're going to start by thinking about what we actually mean by the word demand, because it's often much broader than people might expect. So we often hear parents saying, well, I'm not asking very much. And that's often true, but the experience of demand can be very different from the intention. So when we've talked about what that actually means in autism, we'll then look at everyday communication, because sometimes, even when it's well-meaning, the way we communicate, the way we phrase things can sometimes unintentionally create a pressure. Hopefully a big part of today is going to be practical as well. So we'll go through strategies that you can realistically use in day-to-day situations. So it's not about overhauling everything or every aspect of your communication. It's just about making small shifts that might meet the needs of your young people in a different way. We'll also think about how this approach, low demand communication, can be adapted across different settings. So we'll have a think about not just at home, but also in school or when you're working with professionals. And then as we go along, it's really helpful if you just reflect a little maybe on your own communication style and see what the discussion brings up, and not in a critical way at all. This is about just being curious, really, and noticing patterns and thinking about what might feel different for your child.
Thanks, Zoe. So before we start talking about low demand communication, it's probably important to talk about what we mean by a demand. Like Zoe was saying, it seems quite simple on the face of it, but actually it can be quite complex, particularly within children with a demand avoidant profile. So when we use the word demand in day-to-day conversation and day-to-day reference, we're thinking about direct instructions normally. So things like put your shoes on, come here, do this. But actually demands can be much broader than that. And a demand really is anything that creates an expectation on someone. So yes, sometimes it's an action or a behavior that you're requiring, but it's anything that requires any kind of response. So it can be an expected emotion even. And that includes very ordinary questions like, how was your day? How was school? It requires a response. And because they still require the person to process and to think and to respond in some way, it is experienced as a demand. It also includes social expectations. So the demand to make eye contact directly with other people, that social convention, social norm that most people expect. Greetings, so saying hello, saying goodbye, responding in a certain way, saying certain things that's just expected. Those can all feel like demands. But there's also internal demands. So what we've been talking about is demands that other people place on somebody. But actually there's some demands that come from inside. And that might be the pressure that someone feels to behave in a certain way themselves. So putting their own expectations and pressure on themselves, even if nobody's actually said anything out loud to them. And for some autistic people, those layers of demands, the external, the internal, they can build up very quickly. And so then what seems to look like a small request, a small demand on the outside actually starts to feel very big and broad and complicated to them on the inside. You can see where those layers have built up.
So, thinking about why those kind of demands Jess has just described can feel so challenging, I think it's because for autistic individuals, demands can really trigger a sense of threat or a loss of control. So, it isn't a conscious choice, it's a nervous system response. So, when that happens, when the autistic individual perceives a demand and there's a threat or a perceived loss of control, they can move into what you might have heard of referred to as flight, fight, or freeze state. So that's a central nervous response when somebody is experiencing anxiety. We all have a fight, flight, or freeze response. It's completely normal. It's a natural response to something we perceive to be anxiety inducing or something to be frightened of. But for our autistic young people, that can happen in the face of a perceived demand. And when that happens, when the brain is in that state, it's focused on coping and staying safe. It's not thinking about following the instructions or meeting the expectations. It's really focused on what do I have to do to stay safe in the face of this perceived threat or loss of control. At the same time as well, there might already be lots going on for them. So that might be that kind of demand might be layered on top of sensory input, processing issues or sense of uncertainty about things. And that all adds to the load. And again, increases that central nervous system response, increases that felt sense of anxiety. So when we see avoidance or refusal, because that's often what you'll see as a parent is them being difficult or stubborn or refusing, it's really helpful to reframe that and think about it as their capacity being exceeded. So it's not a willful behaviour. It's not about being disobedient, doing the wrong thing intentionally. It's actually their capacity when there's so many other things already going on and that demand comes in, it's the tipping point really. And I think that shift in understanding is really important because that's what changes how we respond. If we shift away from seeing it as willful avoidance or refusal and into understanding it as a central nervous response, an anxiety response in the face of threat or perceived threat or loss of control, then we'll adjust how we respond to it accordingly.
So some of those behaviours that Zoe's just touched on, refusing or avoiding tasks, you might recognise some of that in the young people that you're here for, or those delayed responses, delaying responding to the demand, or appearing to ignore completely requests that have been asked of them. And sometimes there's a build-up where things might go fine for a while, and their responses seem to be appropriate and that they don't seem to be finding demands difficult. And then suddenly there's this really strong reaction, seemingly out of the blue, to something that seems very small. And I suppose it's a bit like the bucket metaphor that you may have already come across, where every demand put on that young person fills up the bucket a little. And over the day, or over less time than that sometimes, or more time, that bucket fills up. And eventually the final demand, however small it might be, just tips the bucket over. So you get that pattern of increased distress then, with the simple requests leading to this really strong reaction. Like Zoe was saying, it can seem very oppositional, this reaction, or the way they might avoid and delay responses. And it can be very frustrating and confusing to the people around them, especially when you're trying to help as a parent, or you're trying to change something that you can see as a problem. But what's important to remember is it's linked to stress levels. Like Zoe was saying, the response, it's linked to their capacity at that moment. And as the bucket fills up, their capacity to cope with demands is getting less and less and less. And you might also notice that their capacity is less at different times, or certain times things seem harder. So if they're very tired, if they're overwhelmed, if they've had a really busy day, or there's been lots of additional demands on them in school, for example, on one particular day, anything in addition to that at home or in the evening, whatever it might be, creates an even stronger reaction. And I suppose it's helpful to think about that context when you're seeing behaviour that doesn't really make sense, or reactions that seem out of proportion. And of course, it's frustrating and sometimes it's still confusing. But if you keep that in mind about the bucket filling up and the nervous system response, being a representation of their capacity at that particular moment. So it may not be a constant state. It may not be something that is the same in every situation and in every day. That will change according to the context and what else has been going on.
So now that we understand a bit more about what we mean when we say a demand, and those kind of signs of demand sensitivity that Jess has just outlined, we're going to think about what is low demand communication then. And in a nutshell, low demand communication isn't about reducing the pressure within interactions. Sorry, it is exactly that, reducing the pressure within interactions whilst supporting engagement. So it doesn't mean removing all kind of expectations, because we know our young people still need structure and boundaries and support. Those things are really important to help them feel safe and contained. But it means we change how those expectations are communicated. So we're sort of shifting the focus away from getting immediate compliance, and we're focusing more on like creating the right conditions. So making sure it's kind of we have the best chance of our young person engaging, and being able to meet your low demand because they feel safe, they feel regulated, and they feel in control. So we're creating the right kind of setting and context for them to be able to, if we want to call it, comply with the demand or meet that need. And over time, that kind of creating the right setting conditions so that the child feels safe enough and regulated enough to be able to meet those demands leads to more cooperation over time, not less. So it's shifting away from that position of, well, they just need to do what they're told, don't they? And I'm the parent and they're the child. This is what I need them to do. To thinking about what can we do to create that kind of collaborative position where they're more likely to respond in a positive way because they're feeling regulated. Their central nervous system is regulated, and that kind of fight, flight, freeze response isn't so easily triggered.
Sorry, I was mic'd. The core principles then of this type of approach, well, you can see them on the screen. And like Zoe was saying, it's about reducing the pressure within interactions, and you're still giving those demands, but in a more indirect, softer way. And there's a few key principles to try and bear in mind throughout all of the things that we'll talk about following this. And one is reducing the direct demands where possible. Like I said, not removing them entirely because that's not realistic, but softening how they're delivered to the young person and offering some choice so that the young person has a sense of control around how they respond and how they respond to that demand, really. We're thinking about using more indirect language, something that is known as declarative language, which we'll come on to in more detail. And it can feel less pressuring if we're less direct in how we're giving instruction. Respecting the young person's processing time. So processing differences are very common within autism. And allowing extra time, additional time for processing cognitively is really important. And lots of children need longer than you expect, or that is apparent when they are responding to you. They actually probably need a lot longer to really process what's being said, to then make a decision about how to respond and to then deliver that. And quite often parents and caregivers will jump in quite quickly and give the demand again, repeat it again, or do it in a different way, when actually the young person's still processing. Staying calm and non-urgent in the tone of voice that you're using, which can be really hard. Parents are often rushing, they're trying to get things done within certain time frames, trying to get out the door to school, those kinds of situations. It's hard to stay calm and keep your tone very kind of low key and non-urgent, but it can make a big difference. And I suppose overall, remembering that actually underlying all of this that we're talking about is the idea that regulation and the nervous system comes first and should be prioritized. So focusing on achieving that ahead of actually the compliance with the demand can help to move more smoothly into that response that you're looking for. And when a child or a young person is feeling calm and safe and regulated, everything else then is easier for them. So the demands will feel less demanding, if you like, if they're feeling regulated, and their capacity will be more if they're feeling calm and safe.
So thinking about ideas and putting some of this into practice, we're going to look at a number of strategies or approaches we can take that are key really in creating low demand communication. And most of these ideas are really quite simple. So hopefully you'll be able to take away a few things this evening to just try out. Some you may well already be using and intuitively maybe because you've understood that demands are difficult for your young person. The first strategy we're going to talk about is reducing questions. And that's probably one of the most impactful changes we can make by just reducing the number of questions we ask. I think we do it without even realizing, don't we? And the classic is probably at the end of a school day when you pick your young person up and you fire into a round of questions about what did you do today? What did you have for lunch? Who did you play with? Was it a good day? I think we've all had that experience of that being really quite unproductive, and how reducing questions, although questions seem so natural, within them they carry a lot of expectation to respond. And just as Jess mentioned, when you've got a young person who's had a day in school that they've already found quite challenging, they're feeling quite overloaded from a cognitive, sensory, social perspective. A number of questions then, first of all, it's going to take them a lot longer to process what they're being asked, but also it feels like another expectation I've got to answer. It's hard work. I've got to find responses to these questions. And that can feel really overwhelming. So instead of asking lots of questions, you could try just making some comments or observations. So things like, oh, that looked like fun, or sharing the observations like, you seem tired. Or instead of, what did you do at school? You might reframe it and say something like, it looked like a busy day. And what you're doing there really is kind of keeping the connection. So you're recognizing, things might have been tricky for your young person. You're reaching out to them, you're showing an interest, but you're removing the pressure to answer and that additional kind of cognitive load of having to process what you've said and formulate an answer. And you're avoiding kind of triggering them further into their kind of central nervous system response of that anxiety feeling. And often when the pressure is reduced in that kind of way, when we allow space without requiring a response, we find that children are actually much more likely to share, but they'll just do it in their own time. So, it might be much later in the evening that you start to hear a little bit about how their school day has been. And also recognizing their nonverbal communication. So although they may choose not to answer a direct question, you might gauge from their facial responses or their behavior. You're getting information there about what's going on for them and how they're feeling.
So we mentioned declarative language or indirect language, and it's one of the most useful and practical tools that you can use when in attempting low demand communication. And essentially, it's instead of instructing a young person with something to do and telling them what to do, it's sharing information about the situation. So a good example is, rather than saying close the door to the young person, you might say, oh, the door's open and it's getting cold. So you're not giving an instruction, but what it does is it removes that immediate sense of pressure and demand and gives them the space to process the situation and what's happening and actually what needs to happen. And they can then decide how to respond. So it's giving them that sense of control. But also for some children, those direct instructions like please close the door actually triggers an automatic stress response. And it's almost like a reflex, like we've said before, it's not a choice. And this kind of language can help soften that feeling and that impact. It's essentially modeling a way of thinking about a situation rather than commanding the young person with what you want them to do. It feels less confrontational. It can feel a bit unusual to the parent, the guardian to start with, especially if you're used to being a bit more instructive or direct with young people. And it won't always work immediately. It might often be ignored because that sense of vigilance about demands won't pick up on it because it doesn't necessarily feel like a demand immediately. But over time, if you stick with the approach, it can often reduce the resistance that the young person feels and demonstrates, and it creates a calmer interaction. But it's also really important to say that it's not about avoiding clarity and avoiding demands. And when if a situation demands something to happen quickly, if it's an emergency, if you need them to, jump out the way of the car or whatever it is, it's still appropriate to be direct in those situations. We're not trying to say that you shouldn't be giving those instructions. But for the everyday situations that really it's a preference rather than something that really needs to happen, using that declarative, I think, language, and making that small shift in how things are communicated can help to reduce that pressure. And actually, what you might find is that over time, the young person is engaging more voluntarily with the demand. So you're giving them the choice, they're processing the situation, and they're deciding, actually, yeah, the door's open, it's getting cold, I want to close the door. And then from that, they feel more of a sense of control and therefore less anxiety, less of a nervous system response.
So, strategy 3, we're going to think about carrying on a little bit from what Jess has just said, is around offering choice. And as we've said before, offering choice is really about supporting that sense of control. So we know that autistic children will experience the world as really quite unpredictable. So even having a small amount of control can make quite a big difference. When we offer choice, we're still guiding the situation, but we're doing it in a way that includes the child. And that's what's really important. We need to always offer those real and acceptable options, perhaps by keeping the choices simple to 2 or 3 options. And an example of that might be, instead of saying, get dressed now, we might say something like, do you want to get dressed now or in 5 minutes? Or do you want to get dressed now or when that clip you're watching has finished? Or instead of choosing everything for them, we might offer 2 options. So it could be this top or that one, rather than put on that top. The key is that the choice needs to be genuine and manageable. If we offer too many choices, that in itself can become really overwhelming and it's not helpful. And if we offer a choice, we also need to be prepared to accept either option. So making sure that what you're offering is realistic and acceptable. Otherwise, it can feel really confusing or unfair if they choose the option that's not really available to them. And even those kind of small tweaks and those small choices can reduce resistance because, again, like we've said before, it's about shifting the experience away from feeling they're being controlled to more of a sense of being involved and I have some autonomy here. The other important thing to say, which I've touched on already there at the last bullet point, is avoiding overwhelming them with too many choices whilst trying to achieve this.
And going back to the language that we use and coming back to indirect requests. And it's another way of softening what we're saying, softening the demands that we're putting on the young person. So instead of saying, it's raining outside, put your coat on, you could say something like, oh, it looks like it's raining. I wonder if it would be a good idea for us to wear our coats. Or you look cold. Maybe it would help if you put a jumper on. Or shall we try putting shoes on to go in the garden instead of just our socks? So you're still saying the same thing. You're still hoping for the same response, but it lowers the intensity again. And it makes it feel less like an instruction and more like a suggestion. And again, it allows the young person to feel like they have a level of control in their response. It may lead to them choosing to not go ahead and not go along with your suggestion. They may go in the garden without shoes on, and that will be frustrating. But I suppose it's a bit similar to the offering choices. If it's something that you're willing to soften the communication on and willing to make a suggestion rather than a direct instruction, you then have to be comfortable with either way that the young person responds. And arguably, if you can tolerate that, so if you suggest something, they go with the opposite and the outcome that you weren't hoping for, but you can tolerate that, and they see that you can tolerate that, because there's that low demand interaction and there's no response from you as such, that will help to regulate them, really, to keep their anxiety lower. So actually next time they may try the suggestion that you put forward. And for children who are really sensitive to being told what to do, it can make a really significant difference over time. It changes the dynamic between you, and it's from something that feels imposed by you to something that feels more of a shared decision or a shared suggestion. And again, it's not really about avoiding being clear, but matching how direct you need to be, how instructive you need to be to the situation that you're in and the context. But essentially what you're trying to do is collaborate, or allow the young person to collaborate with you and your suggestions, rather than trying to force control and give instructions for something. And in everyday smaller moments, reducing that intensity can actually help prevent escalation before it starts, and it keeps that low demand, low stimulating environment that we're trying to achieve.
We've already talked a little bit about allowing processing time, but it's so important. It's something that's so easily overlooked though as well. You'll probably have noticed that most autistic children and people need longer to process language, especially if they're already feeling like overwhelmed or tired. So after we say something, it can really help to pause. And that can be quite a significant pause, really, five to 10 seconds before you um, put a request or a demand in a low demand way, always allowing those kind of 5 to 10 seconds for processing. It feels like it's longer than you'd usually expect or need, but it's actually really, really valuable and really important, because what we actually end up doing usually is, if we ask something and we don't get a response straight away, we'll repeat it. And sometimes we'll say it with a bit more urgency, because we're assuming, what, have you not heard me? Why aren't you listening? Why aren't you, responding, doing something to indicate you've heard what I've said? And that kind of repeating it quickly, sometimes with that greater sense of urgency, actually serves to just increase the pressure, makes it even harder for the young person to respond. So instead, really important message to take away is try saying it once and then give space. So you're giving them that time to think, to process the information and formulate a response to it. You're also then reducing verbal overload, because you're not going straight into saying the same thing again, perhaps in a slightly different way. And just sitting with that and like accepting there may be those delayed responses is fine. That silence can actually be really experienced as really supportive, even though to us delivering the message, it can feel quite uncomfortable at first, because we're not used to that, like that, having that space for pause and for silence. But actually that's often exactly what the child needs. So always allowing that processing time. And I think this is probably something that's often overlooked or missed, isn't it, in the classroom setting, because things work at such a pace, and the young person is falling behind because they've missed that first instruction, and now they've moved on and there's another set of instructions as well. So for kind of teaching staff out there, it's being aware that this processing time for autistic young people is really important and quite key, I guess, to any kind of engagement.
And then one of the biggest influences on how a demand is experienced by the young person isn't actually just what we're saying, but how we're saying it. We mentioned it already about using a calm tone, which arguably matters more than the words that you're using. So children are very sensitive to tone and the pace of what you're saying, the volume, and the emotional cues that you're giving in your communication. And even the really reasonable requests that you're making can feel really overwhelming to them if they're delivered with that kind of urgency or frustration or general stress within the tone. So part of this low demand approach is about slowing things down, trying to use a neutral tone, a calm tone, reducing the sense of urgency wherever possible, and trying to avoid being reactive, however stressed you might be feeling inside. And thinking about it as a form of co-regulation as well. So regulating your child's, your young person's nervous system by keeping your own in check. Because when we stay calm, it helps them to stay calm. It helps their nervous system to settle in response. And sometimes thinking about that ahead of giving the demand can be really helpful. So it's not always easy, obviously. There are always busy moments, stressful moments, times where you need things done quickly. But trying to think about that nervous system and that co-regulation before then communicating with the words that you need to in order to give that demand can really help slow things down. And even very small shifts, so even within a very stressful moment, if you can just lower your voice slightly or slow your speech, get down onto their level so that you're not having to shout across the room, it can have a really noticeable impact right there and then. And then over time, if you're able to get into that mode when trying to deliver demands, regardless of the environment and what's going on around you, their nervous system won't become dysregulated quite so easily in response to the demands given.
I think, Jess, in relation to that, it's thinking about what we all need, isn't it, when we're feeling dysregulated or quite emotionally distressed? You know, what works for you? And it's always going to be, well, that person who comes across as very calm, has a neutral kind of facial expression, who's talking quietly, who comes down onto your level. Those are all the things that we all find help us to regulate when feeling a bit overwhelmed. So it's thinking that that kind of behavior and approach to communication is consistently is what our autistic young people need. So strategy 7, externalizing demands. So when we talk about this, we mean shifting the demand away from the person. So it's taking the focus away from you as the person making the request. And there's some quite simple and nifty ways of doing this, really. So instead of those kind of demands we make around, you know, you need to turn the telly off now, or you need to turn your tablet off now, you might say something like, the timer says it's time to stop. So, you know, setting timers or planning it according to the time on the clock. You might use a visual schedule that sort of shows what's happening next. So you can say, oh, the planner says we're doing this next, rather than I'm telling you this is what we're doing next. And, you know, by just that subtle shift in how you're externalizing the demands, it can remove some of the personal element. So it's no longer that kind of head to head of you versus the child. That these demands aren't coming directly from you, that there are other reasons why. and when you're using visual supports or routines kind of regularly to work with your young person, that kind of slots in quite nicely into this idea about externalizing demands. It also makes things more predictable if you're using those kind of visual supports and routines. And we know that that in itself, for a lot of our young people, can reduce anxiety. And the reason is that most of our autistic young people can find it easier to respond to something that feels structured and external rather than something that feels like a direct and personal instruction. So this is what we're doing here in externalizing the demands, is helping them feel like they have a bit more autonomy and control over it, and they're not in this you versus the child kind of situation, which is generally more triggering.
So strategy 8 is taking a collaborative approach, but I think we've probably brought that into all of the other 7 strategies. And it's about working with the young person rather than directing them as an overall approach. And instead of telling them what needs to happen, it's involving them in the process. So let's figure this out together kind of attitude. What would make this easier for you? So it's helping, it's collaborating with the young person in order to find a solution to whatever the problem is. And you're actually inviting them to take part in problem solving as well by taking this approach. You're helping them to feel heard and understood and validated. So you can say, you know, I understand this feels hard. I can see it's really difficult for you. What can we do to make it easier? What kind of ideas have you got for us to make a change or to do something differently? And it helps them to feel like they've got some control rather than they're being controlled externally, and supports their own problem solving skills development. So really you're kind of modeling to them the type of thinking that you want them to start doing independently as they're getting older. You're sharing the responsibility, so that in itself makes it feel less pressure for them. And a lot of the demand avoidance is around making the wrong choice and making a mistake. So actually, if you're sharing the responsibility with the young person and taking this collaborative approach, it can help to reduce that sensitivity and the pressure hugely, because it takes the pressure off making a mistake if it's a shared view and shared suggestions. I suppose overall as well, you're building trust with the young person. So they're experiencing you as someone who's alongside them rather than giving them instructions, telling them what to do, controlling what they do. And because that trust starts to build and there's a relationship shift in the dynamics, you'll see more engagement from the young person, and they'll feel again less pressure within those moments, but also day to day within the relationship itself. I think my voice is going, sorry.
Oh. Okay, so thinking about applying everything we've touched on so far at home. And at home, this low demand communication approach might show up in lots of small ways. So it might be that you just reduce the number of repeated reminders. You remember we talked about the questions or the quick follow-ups. We talked about externalizing demands, and you might rely more on routines or environmental cues. So for that reason, going back to what I said previously, using visuals, timetables and schedules and planners can be really helpful for that. You might just be offering more choice in everyday situations. So things that, you know, that kind of flexibility in that choice is much more easy to achieve just in things like meal times or clothing or the timing of things when things happen. It also means being flexible. So recognizing when your young person is just too overwhelmed and adjusting your expectations in that moment. So just being really tuned in and recognizing something we talked about in the last webinar, actually, what are the early signs of your young person in terms of becoming dysregulated, and how can you adjust your expectations in that moment to know actually now's not the right time to place that demand. I need to give them some space. I need to allow them a chance to regulate and to feel safe again before I ask any more of them. I said right back at the beginning, it doesn't mean that there are no boundaries, but what you're doing is thinking carefully about what demands are necessary right now. And we talk about it, don't we, in terms of picking your battles thoughtfully. You know, sometimes we go down a rabbit hole and wonder why we ever persisted with this, because actually that demand or that request in the great scheme of things isn't that significant or important. And just holding that in mind, picking your battles and thinking about how important is this right here, right now. And as Jess has just been mentioning, focusing on connection first, that's the key to all of this, really. And supporting autistic young people is about helping your child feel calm and safe, and doing that through kind of co-regulation, recognizing, validating how they're feeling, sitting with it, helping them to work through it. Because once they're calm and regulated, everything else seems easier afterwards, and you're much more likely to get a child who will respond to your requests and your instructions, and will be much more inclined to kind of go along with things.
So in school, it can be a bit trickier. Most of you, I imagine, are parents or caregivers at home, and it can be quite difficult to try and get this approach put in place in schools. Not least because there's often 30 children in a class. It's quite difficult to apply a very individual approach like this. But generally speaking, I mean, demands are often much higher within the school environment anyway, and necessarily they're less flexible because of the needs of to meet the needs of an entire class, which can make things a lot more challenging. But there are some things that can be done on an individual basis. So avoiding putting the young person on the spot, you know, asking them to answer questions in front of other people without any warning, that type of thing. For somebody who's demand avoidant or demand sensitive, that can be really, really challenging. It can be offering different ways for them to participate in something. So maybe writing things down rather than speaking out loud, thinking of different formats, different ways of responding, or to provide work in different formats can be helpful, and helps to reduce that pressure of performance as well, particularly performing in front of classmates and speaking in front of other people. Giving advance notice of any changes, you know, upcoming changes that teachers are aware of, timetable changes, change of room, change of teacher, that kind of thing. If advance notice can be given, that can really help address those internal demands that we mentioned right at the start. So the pressure to respond to that and to process that unspoken or unwarned change can be huge for autistic young people. And having a bit more advance notice to give them that additional time for processing and to allow them to accommodate the upcoming change can make a big difference. Using supportive, low pressure language in a similar to way as what we were talking about earlier. So as least directive as possible for these young people can make a really big difference as well. But also being flexible and allowing the young person to respond to the demand in different ways where possible and within certain remits. So a good example is allowing them to participate in something through writing rather than speaking. It may be that they do something using technology rather than pen and paper. And obviously, we appreciate that within a class of 30 children, it's quite difficult to accommodate all of that flexibility and individualised approaches, really. But even small changes can make quite a big difference. And reducing the demands or changing the experience of the demand on a small scale can reduce the anxiety to such a degree that actually that young person can tolerate other demands of the day much more easily.
So, common misconceptions. I think we've probably touched on most of these already. So, there's lots of kind of common concerns about this low demand communication approach. One that we've touched on is that we're not saying it doesn't mean no demands at all. That's not the case. There are still like expectations. It's just how we're presenting those demands or those requests. We're just shifting how those messages are delivered. Another one is that it's permissive, but actually it's not. It's about being thoughtful and really strategic in how the demands are presented. So it takes quite a lot of practice and work by us to be that kind of thoughtful and strategic, to think how can what I need to achieve, what I need them to achieve, what's the best way of doing this to stand the best chance of success. So those boundaries still exist. We're just being really thoughtful and strategic in how we achieve the desired outcomes. And as Jess said, really importantly, the safety related expectations still need to be clear and direct, because, we're often in situations where we don't have that time to think about how am I going to phrase this. If there's a risk to the young person or to others, they need really clear and direct communication and action in that very moment. And importantly, to remember that reducing pressure doesn't reinforce avoidance. So it's not the case of, well, if they don't get used to this, how are they ever going to function? What we know is that often that low demand communication leads to more engagement over time, and we know that that's happening because a child feels safer and therefore more able to participate. So there's a greater sense of kind of cooperation and going along with things rather than a greater sense of avoidance. So yeah, that is quite important to dispel some of those myths, particularly if maybe you're trying to explain your approach to others who don't understand the importance of this for neurodivergent young people. And we're talking about this approach needing to be flexible, so there's not one set of rules that are going to work for every individual child. It really is about learning about your own young person and what works for them.
So the things that we hope that you'll take away from this evening, in summary, all communication can carry a demand for a neurodivergent young person, even when we don't intend it to, and even when it doesn't sound like an instruction. There's lots of different layers of demand, and autistic young people specifically are very sensitive to that experience of demand. And it's the anxiety that's reducing the ability for them to engage in it and to respond to the demand appropriately. It's important to remember that's what's underneath their behaviour, and it's all around the nervous system and dysregulation. That's the most important thing to prioritise when we're trying to change this. Small changes can make a huge difference. So the language, the wording, the tone, and the timing can have a really big impact, both at the time and also over time. And actually allowing a sense of control and autonomy in the young person will support them to cooperate. And it may feel a bit counterintuitive, like what Zoe was saying, but over time we've seen, within research, within day-to-day clinical practice, we've seen that allowing further autonomy does actually allow more engagement, more cooperation, and that's because of regulation of the young person's nervous system. I suppose we want you to be thinking about it being a supportive interaction style. So it's not about doing it perfectly every time and staying, low demand and low arousal approach. You may have come across that as well, where your communication is very low key at all times. That's not realistic, and nobody would be able to do that at all times. But I suppose bearing in mind that the flexibility is important and remembering that collaborative element. And if you hold those things in mind, so being flexible and being collaborative, then you can hope that the young person will feel that sense of trust building, less pressure, less anxiety in the moment, and essentially they will be regulated enough to then make choices, to choose how to respond to a demand, and they will feel more confident over time as well and become more autonomous themselves.
So just to kind of pulling it all together and thinking about what you can take away from the session today, it's helpful now really just to take a moment to think about your own communication style, and think about that in relation to the young person that you're supporting. Is there like a situation that comes up regularly where things feel difficult, and could that be related to the way in which things are being communicated? Thinking about is if there's a demand that could be softened, or a place where you could offer more choice. How could you allow more time, or reduce the number of questions? Just thinking about that in your day-to-day communication with your young person. And thinking maybe about one thing you could try this week out of everything you've heard tonight, because we know that even just that one small change can make a difference. And actually, that's the place to start, really, is with just making one small change. That's absolutely fine to start small and to take it from there. And remembering, like we've said throughout, that this can feel like quite strange, quite uncomfortable. It's a different way of communicating. It might not come naturally. So, to recognize that and give yourself some grace when it doesn't always feel easy to achieve, but just knowing that you have this understanding and trying out one or two of these little strategies when you remember and when you get the opportunity to see what works for you and your young person. So that brings us to any questions that might have come up in the discussion today. We've got about 15 minutes or so to take questions. I'm not sure. I haven't been looking at the chat. Sorry, there's probably some. Is there some in the chat?
That's okay, guys. I've got them written down here. So we have one question from Sadia. How to help an autistic child when he's screaming and yelling and every morning after breakfast?
Oh, that's difficult because that's such a difficult time of the day, isn't it? Often when we're under a lot of pressure, we have to try and move things along, trying to get out of the house on time. I mean, there could be lots of things going on there. I'd be thinking about the context, what's happening for him. Is it that transition from breakfast into maybe having to leave the house? Is this what he's experiencing, this anticipation? Could it be related to what he's wearing, how that feels, what the breakfast has been like? He's trying to communicate something, isn't he, through that screaming and yelling? So it's a bit of a puzzle to try and work out what that is, and maybe starting by reflecting back to him to say, I can see you're feeling really, whatever word you might use to describe it, cross, frustrated, angry, worried or anxious, and start there with that. We mentioned it before, didn't we? Trying to get that connection and that kind of co-regulation before trying to place any demands or expectations about, but it's time to get your shoes on now, we've got to go.
Okay. Sorry, we have a question from Naola. What do you do when you have some level of low demand communication at home, but it doesn't happen elsewhere, such as in school, especially at secondary school when there are a number of different teachers?
Well, that is a challenge, isn't it? Because they're coming into contact with so many different people, and I think it's really hard to get those kind of messages across in a mainstream big secondary school setting. But what I would say is that you're building the right blocks there by achieving low demand communication at home, because we talked, didn't we, about that cumulative effect. So at least if your young person is feeling relatively safe and regulated and calm at home, that's a huge plus. You're obviously you developing a good understanding and awareness, and they're appreciating that. I guess it is just having an opportunity when you do to speak with members of staff at school, maybe through the Senko, to just remind them as part of their SEN support plan that this low demand communication is really important. And that might just be remembering that they don't like to be put on the spot or ask questions in the middle of a class without offering to answer a question. Just some really, little simple things that might be easier for different teachers to hold on to and remember, if there is some kind of guidance for them around the best style of communication for them.
I know it's more common in primary school, but something like an individual passport, if you've come across that idea before. So I suppose it's a kind of profile of a young person and what helps them, what they find challenging. And it can be a one-page summary with particular specifics on there that you want teaching staff to be aware of with the young person. It's something that could be communicated and shared with all the staff who are teaching them. So they don't have to keep repeating, or you don't have to keep repeating what helps them or what you want them to try and avoid. If it's written down in there, I suppose it's almost like a care plan. So it's it's a way of sharing their particular profile and challenges without having to constantly discuss it. That might be something to consider developing.
Okay, we have another question from Sadia. Someone told her that speech therapy has no role in autism management and only behaviour therapies help in management. So she would like a clear answer regarding speech therapists and behaviour therapist roles in management of autism.
Wow, that is unusual. I mean, I think maybe, do you think they're referring to like functional speech therapy? Because obviously there's different types of speech therapy, but in the world of neurodivergence, you'd be working really with a speech and language therapist, where it's more about the use of social communication and supporting alternative communication based on that young person's communication style and preferences. So from our perspective, there is a big role for speech and language therapists in supporting autistic young people. That they, in our service, they're a really important member of the multidisciplinary team. They're often key, actually, in if you're thinking about individual profiles, because understanding that person's communication preferences is so important. So yeah, a clear answer on that is that we do think speech and language therapists play a really important role, but maybe they're confusing it with the functional speech. So where you might use a speech and language therapist for like stutters or stammers, or the kind of there will be a technical term for this, but the clarity of their speech and communication. And behaviour therapists, I mean, I don't know if you're referring to approaches, historical approaches like ABA, where there were approaches about shaping the responses of autistic people so that they would become more neurotypical, if you like. That seemed to be the ultimate aim. And we've moved well away from that. So we'd be less likely to use behaviour therapists in managing autism, certainly not applied behavioural analysis approaches, which behaviour therapists are generally aligned to. But we might draw on principles around understanding the function of behaviour. So what is the behaviour communicating, and an assessment to understand that, so we can make recommendations about how to meet that young person's needs in a different way.
Okay. We have another question from Naola. What is the best way of helping older children, i.e. 15 years, to adopt coping mechanisms when faced with demands outside of the home?
Sorry.
I was just I missed a bit of that question. 15-year-old, I was just trying to find it in the chat. I can't see it.
The coping outside the home with demands. I suppose it's about allowing, at that age, it's about the autonomy again, and helping them to develop kind of practical skills that they can use on their own. And it's almost, I suppose it's almost like being a bit of a detective with them and working together or alongside them to try and work out, you know, what they find difficult to start with, what particular demands are the most challenging. And by doing that, by having that conversation with them and doing that detective work, you're helping them to build ownership over their response in that situation, how they can feel differently. I think as psychologists, we like to be curious and to find out what's causing problems, and noticing things, and almost journaling and doing diaries. So you could encourage them to help notice unhelpful thinking or whatever's going on before that demand or that difficult response, and maybe doing something quite subtle or quite simple with them. So things like breathing techniques and mindfulness exercises and that type of thing, they can then employ those when they're on their own independently. So it's all about really ownership and developing autonomy so that they can implement strategies when they're not with you. And I suppose that starts with working out exactly what's going on so that they can identify when to implement strategies.
It's sort of moving from the younger years of kind of co-regulating and learning how to manage emotional distress alongside you as the parent at home to becoming slightly more independent and needing to find and develop their own ways of self-regulation to manage things that are going to trigger their central nervous system response. There might be sensory things there that they find regulating and comforting too. And also it's about self-advocacy, isn't it? I think it's helping your young person recognize those things that they find really difficult and to be able to ask for adjustments for themselves where they know they're not going to, or they're going to find certain situations difficult.
Okay, we have a question from Mabasa. How do you communicate a safety plan when the young person has the fixation of vocalizing unsafe behavior, such as wanting to self-harm?
Sorry, I'm just looking for that one again. Communicate a safety plan when the young person with fixation of vocalizing unsafe behavior, such as wanting to self-harm. Again, I suppose it's got to be thinking about what's going on for them when they're making these statements, or they're expressing this desire. They must be feeling, quite high levels of distress. And one way of letting people know about that is by making those kind of statements. So it's letting them know that you can see they're really struggling, they're finding something really difficult, and you'd like to be able to help them with that, and working on that safety plan together. So maybe working with them to understand what's going on that triggers them into that position. What kind of things are they finding really difficult to cope with, understanding their triggers, and within that safety plan, helping them to recognize their own early signs. How do they know that things are becoming difficult? Do they notice? And documenting all of that, and then documenting within the safety plan some really kind of practical strategies about, when I'm feeling like this is what can help me, this is who I can call, this is what I need from other people. So again, making a safety plan that's really clear, easily referenced, and that's being collaborative, so they have that kind of sense of ownership over it as well, that it feels like it represents them well.
Okay, we had one question sent in ahead of the webinar, and it was, my child will agree to things in the moment and then refuses when it's time to do the task. What should I do in these situations?
So we'll agree in the moment, and then when it comes up, yeah, that does happen quite a bit, doesn't it? And it feels really sort of self-sabotaging sometimes. But again, I think that's probably because that's been experienced as an internalized demand. So it's a bit like they had some choice and they made a decision to do it. At the time, it sounded like something really good that they might actually enjoy. But then as the time creeps a bit closer, they have that sense of, I'm expected to do this now. There's a bit of sensed pressure, and also I want to do it, and that in itself can feel like a demand and an expectation. So that kind of sabotage does happen sometimes in the demand avoidant profile.
I suppose as well, if you're talking about it in advance when they're calm and regulated, they're more able to make that choice and decision that they're going to do whatever it is, engage with whatever demand it is. And then the time comes and actually the sensitivity is there. It's almost like the anticipation of something big looming, and it gets worse and worse and worse, and then it's too much to cope with, so then it's avoided.
It's often like the experiences of birthdays and Christmas, isn't it, for neurodivergent young people, that they really want to enjoy it, but just everything becomes too much and they completely crash and burn or opt out of it altogether, or something goes quite catastrophically wrong because of that perceived sense of pressure about, I've got to do it now, I'm expected to enjoy it, everyone else is enjoying it, why can't I?
We had another question who's sent in by Sahida, who couldn't make it tonight, but she said, we end up running late every day because I'm trying not to push my child to that meltdown stage. How do I find the right balance?
But that is difficult, isn't it? Because you're doing the right thing by removing the pressure. I wonder if it's something about externalizing the demands there, maybe by planning with your young person in terms of agreeing with them around what kind of time do we need to be ready by, what's the schedule say for the morning, how do we have to work through these things to try and be on time. But I would also always say that actually it's much better doing what you're doing and allowing the time for your child to stay regulated, for example, in the morning schedule of getting them to school, rather than them becoming really dysregulated and arriving at school in that state, because they're going to have a bad day, aren't they? So yeah, working with them about what's going to make it a bit easier for us in the mornings. Maybe talking to school also about mornings is a big challenge. This is a really difficult transition, but I want them to arrive in a kind of calm frame of mind.
Somebody mentioned on the chat as well about a timer that has helped them, or most of the time helped them with transitions. And I suppose that's externalizing it, isn't it? It's demonstrating that there's a demand, but it's not from the parent as such. The timer is the one that's requiring things to be done, which can help.
And it just makes things visual, doesn't it? Because sometimes neurodivergent young people can struggle with that, like estimating the passage of time. So when you're saying to them, you've got 10 minutes, they've no real sense of how long that is or how many things they can achieve in 10 minutes. Whereas a timer that kind of visually shows that countdown is better than those kind of verbal prompts.
I think that's the end of the questions, guys, unless anybody's got any more.
No, that's fabulous. Thank you, everybody. It's really good questions. Thanks for your participation, and well done, Jess. You managed it.
I'm going to go and cough for about an hour now.
Yeah. Okay. And we'll be back again. There'll be another webinar coming up.